Hi, my name is Dr. Rudra Mohan and through the Oral Health channel, today we're going to be talking about the art and the science behind tongue cleaning. So today's episode is a very important episode when it comes to oral hygiene, and I went through the literature about the science behind tongue cleaning and what is the rationale behind it. So your oral environment, the mouth and the oral cavity actually has a lot of bacteria, and these bacteria actually lie in a lot of ecological niches. Now tongue being a very corrugated, a fissured organ, a muscular organ having a lot of troughs and depressions and clefts and or crypts, is an ideal site for bacterial debris, food, epithelial cells, saliva and all these things to collect and lead to a coated tongue, which can lead to foul malodor, which can lead to bad breath or halitosis, which can cause social stigma and social problems, and such as a lot of discomfort in terms of the image and confidence. So I would strongly recommend, if you're planning to improve your oral hygiene, you should also start incorporating tongue cleaning in your daily home care regimen, apart from toothbrushing and flossing. Now tongue cleaning can be done in a lot of ways with a lot of aids, such as tongue scrapers that are present on the back side of your toothbrush. You have stainless steel tongue scrapers and you have plastic tongue scrapers. From my personal experience, I've noticed, and from the literature that I've read, the most effective form of cleaning the mouth is through toothbrushing and tongue scraping, and between the stainless steel and the plastic tongue scrapers there's not much of difference. But however, from a trauma standpoint, it is much better that you use a plastic tongue scraper, because of the fact that the stainless steel tongue scraper is actually very sharp, and I've seen it in my practice that a lot of patients end up having a lot of injuries in their tongue. Now you might ask how much and how many strokes that we have to use. That also depends upon the amount of content or the coating on the tongue. The moment you feel that the coating has been dislodged, and then you can wash it or rinse it with your water, it's good enough. That is the end point. However, from a patient standpoint, a lot of people tend to have gag reflexes, because of which they prefer the toothbrush head tongue scraper that is present on the back. However, from a scientific point of view, you might not be able to reach all the places, the crevices of the tongue. So in studies, it has been found that the tongue cleaning action actually has helped in reducing the oral bacterial count, anaerobic and aerobic, because of these aerobic and anaerobic bacteria and all these shedded cells and all the other things and the debris. Once they reach the crypts of the tongue, they go under putrefaction and they release something known as volatile sulfur compounds that are responsible for oral malodor, that means bad breath, and it can lead to a lot of social problems, because we are all at the end of the day social animals. So it is always better that you should go for tongue cleaning exercises along with your toothbrushing and flossing as a part of your daily regimen. However, I would want you to practice caution in terms of the intensity and the duration of the tongue cleaning, so as to you don't cause injury to your tongue, you don't cause any sort of ulcerations to your tongue, and at the same time you don't have a lot of altered taste perceptions because of the fact that you have eroded your tongue with a lot of vigorous tongue cleaning. It's very important. The end result basically should depend upon that the coating should be washed away. However, it also depends upon what you have consumed, how much water you're consuming, how dehydrated you are or hydrated you are, what medicines you're consuming, are you consuming alcohol, cigarettes, tobacco or anything of that sort. So there's a lot of confounding variables, but however, it is still very important that you should, as much as possible, incorporate the practice of tongue cleaning in your oral hygiene daily home care regimen. So this is today's episode. Please like, share, subscribe and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message with your name, your location and the common oral health problem that's causing you discomfort or concern on WhatsApp, and I'll probably reply within a couple of days. I might be busy, and then we can have a dialogue about it. And if you have any queries, doubts, apprehensions or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.